see, but that's not going to make much of an impact. So why not get it out there to everybody, what we know already?
Right. Well, I appreciate that. And it strikes me that interacting with school nurses and getting school nurses engaged in this is one way to make sure that the schools have that information from the viewpoint of a healthcare professional. So I appreciate that. Thank you very much, Mr. Chair.
Senator Cassidy. Yeah, I'm a doctor. You're going to see my questions kind of reflect, the technical aspect of this. By the way, you're talking about having to leave West Virginia, beautiful state, to move to being closer. You're talking about Miss Beal, et cetera, same sort of story. Is telemedicine, are people using telemedicine for this? Because I'm thinking that probably the examination is not showing very much. It's an interview and they're asking your response. So is Virginia Medicaid covering telemedicine, or your insurance plans covering telemedicine?
I can say that, yes, my health plan is covering telemedicine. However, many of the specialists that I and others have seen are out of network and sometimes even out of state, which are not necessarily always covered. Many of the folks who have treated...
Now, are the doctors themselves, herself, himself, requiring you to show up in person, or will they do a telemedicine interview as at least an intake interview?
It depends. And I think for those of us who can get in that first appointment via telemedicine, it's great, but so many are in boutique practices.
So, Ms. Beal, your experience?
For me, telemedicine, telehealth is available with my health insurance. However, when I'm seeing a specialist, I want to see them. I need to be in the room with them. I want them to see me, all of me.
Oh, I get that.
So
Believe me, there's a therapeutic aspect to that interview, which as a physician, I'm so aware of. Sometimes for follow-up, it helps, though, particularly since you had mentioned the drive is so fatiguing. Ms. Heim, your experience?
When we lived in West Virginia, WVU had a telemedicine office for children. So what would happen was we'd go see the specialist in Morgantown, and then for prior visits after that, we would go into an office and see a nurse or a PA, and they would essentially wheel the doctor in on a screen, and we would still get that visit. That was powerful. However, as a child, they required us to be at the hospital to do colonoscopy and pulmonary. All the testing always had to be done at the hospital. So even with that help of the telemedicine, we still had to travel quite a bit.
Let me ask you.
Children's, of course, they have not done the telemedicine because a lot of times the doctors aren't licensed in different states. So you have to be in the state in order to see the doctor. So sometimes we'll drive and just kind of park and then see the doctor on the side of the road, but that's not very convenient.
Now, you've been involved in children's, and as y'all were talking, I was on PubMed, looking at some of the articles and stuff. And the therapies, are they actually giving your child therapy at children's? Put it this way, is she in clinical trials testing different therapies as to what might be benefiting her?
So there's two separate things. There's the long COVID clinic, which has the doctors and the specialists, and then there's the NIH study that's run through children. So the study is just gathering information.
It is observational. It is not
Two of my
therapy.
children are in that study because as a parent, that was the only thing we could do to help the situation is to give them information. So we just do the study to help. We get information sometimes, but mostly it's just them, doing testing and questionnaires and stuff. The actual clinic has offered advice and treatments, and some of them have helped, yes.
Okay, now the treatment, some of them are like massage. You had mentioned how massage therapy, et cetera. Are any of them clinical trials? We're going to try this drug versus placebo to see if this drug is beneficial.
So I don't know if it's trials necessarily, but again, they've learned that there's COVID in the stool, right? So one of my daughter's symptoms was she was nausea and vomiting and constipation and pain every day for like 6 months. She walked around with a puke bag in her hand all the time. And when we found out that it might be in the stool, we did a clean out through a colonoscopy. That was kind of by chance, but nevertheless. And then we started on a pro and prebiotic that children's recommended. And those symptoms almost completely went away.
Really?
Yes.
That's great. And that was not part of a clinical trial. That's just kind of like...
but that's what I'm saying. I want the doctors to know what we're learning because somebody could be having nausea and vomiting and pain, and all they got to do is clean out their gut because COVID's still there a year later.
Well, the probiotics helped. I mean, obviously,
Yeah.
it's more than cleaning out the gut. But anyway, that said, Ms. Vasquez, post-exertional issues are major. I think everybody's describing you get tired, and you were the runner, so you're going to notice it most. So has there been, and I've read that there is some problems with the mitochondrial, so this may not be reparable, but in other cases, they're talking about how gradual physical therapy, et cetera, can actually be a positive thing. What therapies have been attempted for you as a former runner to attempt to recover your ability to exert?
As a former runner, I know what it's like to push through and overtrain to the point of stress fractures. And exercise is not good for me, especially when
But there's passive resistance, for example, where the physical therapist kind of moves you back and forth, et cetera. And I'm not prescribing that. I'm just wondering, is what's being tried?
I will say that there's just so much evidence that post-exertional malaise is the downstream effect of exercise. And I think exercise and movement will improve when we manage the upstream drivers of post-exertional malaise.
Okay. Okay. Mr. Chairman, I yield. Thank you all.
Senator Kane.
Thank you, Mr. Chair, and I really appreciate the witnesses being here. You know, I think it's an honor to testify before the United States Senate. Can also be a hassle, but for y'all, it's an additional burden.